Cholesterol is a type of fat that plays an essential role in how the body works. It's part of the outer layer or membrane of all of your cells. It's also used to make vitamin D and steroid hormones, which keep your bones, teeth, and muscles healthy. Finally, it's also used to make bile, which helps digest the fats we eat and absorb fat-soluble vitamins. There are two main types of cholesterol. LDL cholesterol is commonly called the bad cholesterol because too much of it can lead to plaque buildup, which clogs up your arteries and leads to health problems later on in life. For example, heart attacks, strokes, and chronic kidney disease. HDL cholesterol is often called the good cholesterol because it helps carry excess cholesterol away from your cells back to your liver to be broken down. This helps prevent disease. You may also hear your doctor talk about triglycerides. These are fats formed in the body when excess calories are consumed and not used immediately for energy. These also contribute to the process that clogs up your arteries. I would usually recommend lifestyle changes as the first step in managing raised cholesterol, and these include maintaining a healthy diet and healthy weight. Exercise, I would usually recommend a minimum of 150 minutes of moderate intensity exercise, where you raise your heart rate and breathe slightly harder, or 75 minutes of high intensity exercise a week. I believe stopping smoking is essential. Smoking acts to speed up the process which clogs up our arteries. It makes your LDL cholesterol stickier and it damages the walls of your arteries, which then encourages cholesterol to build up in these damaged areas. I would recommend reducing alcohol intake to under 14 units a week. Alcohol acts to raise your triglycerides and cholesterol in your blood and results in a fatty liver, which over time is less able to remove cholesterol from your blood. I would recommend avoiding saturated fats like cream, cheese, full fat milk or yogurt, butter, coconut and palm oil. I would recommend cutting down on sugary food and drinks. Eat less red meat. You can substitute peas, beans, lentils, fish, nuts, chicken where possible. And if you are eating red meat, try to ensure it's as lean as possible. I would recommend avoiding processed foods such as sausages or bacon. And overall, limiting pastries, cakes, biscuits, fried foods, takeaways, and hard margarines are a good idea because these often are high in saturated fats or are highly processed. It can be reversed with medication if lifestyle changes are not enough to lower cholesterol by itself. There are a variety of medications we can prescribe. Statins, for example, atorvastatin or simvastatin are the most commonly prescribed cholesterol-lowering drugs. They reduce LDL cholesterol production. In recent years, there has been a fair amount of publicity regarding statins and their potential side effects. But you need to consider that many people who take statins have little or no side effects, and balancing this up with the benefits of preventing heart attack, stroke, and chronic kidney disease should always be taken into consideration. Other medications like ezetimibe, which can be prescribed alongside statins or alone if you are intolerant to statins, they help reduce cholesterol absorption from food. There's also PCSK9 inhibitors, which are usually given for patients with familial hypercholesterolemia or those who need further lowering of LDLs despite using statins or ezetimibe, and these medications are injectable. There's also fibrates, which are used for patients with very high triglycerides, and there's a group of medications called bile acid sequestrants, which are less commonly used these days because we've got newer options or newer medications available.